Hello. Assertive communication in the health and social care. Hello, my name is Judith Nagy, and today I will presentation on the assertive communication in the health and social care. In this presentation, I will analyze what assertive communication is, its strengths and limitation, and how it's applied in the healthcare setting. I will also reflect on my own communication skills, how they can be developed for the future practice. Slide 2 Introduction. Communication, one of the most important aspects of the health and social care practice. Poor communication has been identified as the major cause of clinical errors and patient dissatisfaction. Therefore, effective communication is essential for the safe and person-centered care. In this presentation, I will focus specially on the assertive communication. I will evaluate how it supports teamwork, patient safety, and effective care delivery. I will also reflect on my own communication style and areas for improvement. Slide 3. What is the assertive communications? Assertive communication is the style where individuals express their thoughts, feelings, and needs clearly and respectfully without being passive or aggressive. It is considered as the balanced communication style where both the healthcare professional and the patient's needs are respected. It often involves using the statements such as understand your concept or I would like to explain this future. According to communication theory, Sackett Thomas and Kilman model, assertive communication sits between passive and aggressive styles, make it the most effective in many healthcare situations. Slide 4. Strength. One of the most strengths of the assertive communication is that it improves patient safety. Clear communication reduces the misunderstandings, especially in clinical instruction and treatment plans. It also helps build trust between patient and healthcare professionals. When patients feel heard and respected, they are more likely to engage in shared care. In addition, assertive communication improves teamwork within healthcare and environments. It allows staff to express concern clearly, which can reduce the errors. Research suggests that assertive communication contributes to better patient outcomes and improves satisfaction, especially in the high-pressure environments such as hospitals. Slide 5 Limitations. However, assertive communication also has some limitations. In some situations, it may be pervasive, too direct, or even disrespectful, especially in the culture where indirect communication is more common. It can also be challenging when dealing with the highly emotional or aggressive patients, where maintaining assertiveness requires strong emotional control. Another limitation is that not all healthcare professionals are trained or assertive communication, which can lead or inconsistency in practice. Therefore, although it is effective, it must always be adapted depending on the patient and situation. Slide 6. Application in care. Assertive communication is highly important in the person-centered care. It supports informed consent by ensuring that patients fully understand their treatment option before making decisions. It is also practically useful in mental health and dementia care, where clear but respectful communication is needed to reduce confusion and anxiety. In practice, it helps healthcare professionals explain complex medication information in simple and structured way. However, it's important to adapt the communication depending on the patient emotional state, level or understanding, and vulnerability. Slide 7. Collaboration. Assertive communication is essential for effective teamwork in the health and social care. It improves communication within the multidisciplinary team where doctors, nurses, and other professionals must share information clearly. Tools like SBAR, situation, background, assessment, and recommendation, rely on clear and structured communication, which is aligned with the assertive style. It also reduces the hierarchy barrier, meaning staff feel more confident to speak up if they know risk or concerns. This leads to improved patient safety and more efficient decision making within teams. Slide 8. Scenario explain. For explain in the ANIA setting, and the patient may become frustrated due to long waiting times. In this situation, a nurse using assertive communication would remain calm, speak clearly, and acknowledge the patient feeling why, also explaining the situation professionally. For instance, they might say, I understand that you are frustrated and I want to help you. At the moment, we are treating patient based on urgent and I will update you as soon as possible. This approach helps to reduce conflict anxiety while maintaining professional boundaries. It is demonstrated how assertive communication can de-escalate situation and improve patient cooperation. Slide 9. Reflection. Reflection on my own communication skills. I believe one of my strengths is active listening. I try to understand what others are saying before responding. However, I also recognize that I sometimes lack confidence when being assertive, especially in difficult or confrontation situations. This can affect how I clearly express my own view in professional environment. To improve this, I can to develop my assertiveness skills through training, practice, and using structured tools like SBAR. This reflection is important because effective communication is essential for my future role in the health and social care. Slide 10. Conclusion. In conclusion, assertive communication is the key skill in health and social care. It improves patient safety, support teams, and enhances the quality of care and provided. However, it's not just one size fits all approach and must be adapted depending on the situation and the individual. Overall, developing assertive communication skills essential for the both professional growth and effective healthcare practice. I hope I can help you understand more about the assertive communication, and you can see more clearly how, when, and how we can use that one. Thank you for listening. Thank you. Bye.